When the whole coronavirus crisis started to escalate in the United States over a month ago, the call from frontline healthcare workers could not have been more unified. We need more personal protective equipment, PPE, ASAP. Since then, the risk to frontline healthcare workers has been well documented and unfortunately proven by the large number of deaths. I work in more than one healthcare facility in Massachusetts. Despite some initial concerns, I do consider myself somewhat lucky because our hospitals have provided the staff with adequate PPE. However, I know this hasn't been the case everywhere. The stories back in March about healthcare workers wearing their own scarves and bandanas while seeing COVID patients were absolutely shocking. At that time, hospital leaders and political leaders promised that industries would be mobilized to get PPE to the front lines ASAP. In a country as rich as the United States, it's inexcusable that weeks into this crisis, we're still hearing about PPE shortages. For anyone not medically trained who's listening to this, by PPE, what most doctors and nurses are most concerned about before entering a COVID patient's room is having an N95 respirator. It's a relatively simple mask that goes over the mouth and nose, typically costs less than $1 to produce. Before this crisis, most of these were produced overseas, ironically many in China. In addition, what we need to protect ourselves, we need face shields, we need gowns and gloves. We also need adequate abundant supplies of sanitizer, disinfectant wipes, and also surgical masks. The United States is the richest country in the world with an economy worth $20 trillion. We have modern, sophisticated hospitals. We can perform heart transplants, minimally invasive surgeries, and administer other cutting-edge treatments. Away from medicine, we can build mind-bogglingly big skyscrapers and bridges. Our military has unbelievably futuristic technology, and we can also launch shuttles into space. How difficult would it have been to mobilize our entire industry to at least make N95 respirators and get millions of them to the front lines? Think about this. We're used to talking in costs in terms of hundreds of thousands, millions and billions, and an N95 respirator is less than $1. I know that many small and large companies have been trying to make more PPE, but this hasn't happened nearly fast enough. We're now weeks into this crisis, and the fact that there's still stories of PPE shortages is a national disgrace to America.